Recent data from the American Heart Association show that heart disease continues to be the #1 killer of Americans. And in fact, someone dies of heart disease in the U.S. every 34 seconds. However, taking statins can affect the level of an important enzyme in the body, CoQ10, which is essential to protect the body from cell damage. And with me is Dr. Tania Elliott to explain a study recently about this, what it means for us, what we can do about it. So welcome, doctor. Great to have you here. And let's just start with, what is CoQ10? Why is it important to heart health?
Yeah, thanks so much for having me. So let's just break this down, right? Coenzyme Q10 is a compound that is essential for our muscles to create energy and for our muscles to function. And the highest concentration of coenzyme Q10 is in our heart. Most people think, oh, my heart is an organ. It's a muscle, right? It's pumping and it needs coenzyme Q10 for energy and to function properly. And then coenzyme Q10 is also present in other muscles in the body. Now, coenzyme Q10 decreases with age, and it also decreases with statin use. So statins are the most commonly prescribed medication for high cholesterol and for heart disease, and are really important and really good at lowering our cholesterol levels and reducing risk of heart disease. The problem is that statins also inadvertently decrease our coenzyme Q10 levels. So it's really important to drive awareness to say, I'm on this important medication for my heart. Coenzyme Q10 is also important for my heart, but this medicine also reduces coenzyme Q10 levels. Maybe there's something I should be doing about it. Maybe I should be on a supplement for it.
Okay, so we'll talk about that here in just a second. But this study, what was kind of the big information that came out of this study?
Yeah, so this study was conducted by Doctors Best, which is a leading high quality supplement company. And so they asked survey respondents, like, what's your risk of heart disease? Are you even aware? 60% of survey respondents were not even aware of their risk for heart disease. So that's mind-blowing to me, because as you mentioned, one person dies every 34 seconds from a heart-related condition. And, we know that it's the #1 killer. 60% of people didn't even know their risk. The other thing that was interesting about the study is that 50% of Gen Zers, right? We're talking people under the age of 30, were worried. They were worried about their heart, and they were citing chronic stress as a major risk factor for that. And they were experiencing symptoms like fatigue and shortness of breath and just not feeling right. And then 17% of those Gen Z respondents were actually on a statin, right? So these are people under the age of 30, right? We typically think, oh, they're generally healthy, right? 17% of those survey respondents were on a statin, meaning that they either have high cholesterol or were at risk for heart disease, because that's the only reason why we put people on statins.
Yeah. That's fascinating and a little sad about Gen Z. I have a couple of Gen Z kids. So talk about what steps people can take to protect their heart, but also make sure they're getting this essential enzyme, this CoQ10.
Yeah, I think one thing is just understanding that correlation between being on a statin and reduced coenzyme Q10 levels, and having a conversation with your doctor about whether or not coenzyme Q10 supplementation is right for them. And it can help for two reasons. One is that studies show that when you're on coenzyme Q10, you have better cardiac outcomes. And the other shows that people that are on statin, they often complain of muscle aches and pains, right? And coenzyme Q10 supplementation can help with that. So it can lowering the statin dose, but like coming in as an informed consumer to your doctor, having that conversation and saying, hey, is supplementation right for me? And the reason I talk about supplements, I usually say, hey, just eat your vitamins, right? Just get it through your food. It's kind of hard to get coenzyme Q10. It is present in fatty fish and legumes, but the most common place you can find coenzyme Q10 is in organ meat. And I don't know too many people that eat organ meat. So it's something that you may want to consider taking a high quality supplement for.
Yeah, that liver, like not really.
Yeah, I don't want that liverwurst sandwich. Sorry. Okay. Yeah.
So where can people go to find out more information? And I guess talk to your doctor about this as well, right?
Yeah, so check out doctorsbest.com. And the next time you see your doctor, make sure you understand your heart disease risk, have that conversation, and then see if CoQ10 supplementation is right for you.
Okay, Dr. Elliott, thank you so much. I have heart issues in my family, and I didn't know about this, and it's wonderful to know. And I'm sure a lot of people are like that. So thank you so much for your information.
Yeah, thanks for having me.